So I felt okay for a while now. Can I reduce my treatment or take a short break from it?
The answer to the question of how long does a lupus patient need to be on treatment depends on what kind of involvement you have. In other words, lupus can affect any part of the body, and I tend to try to divide lupus into two categories: organ-threatening or more serious, and non-organ-threatening or milder. Organ-threatening being, let's say, involvement of the heart, the lung, kidney, liver, brain, bone marrow. And non-organ-threatening lupus would be patients who, perhaps like yourself, who are tired and achy, have joint pain, maybe a little pleuritic discomfort or discomfort on taking a deep breath, some mild rashes. And those who have organ involvement usually are given very high doses of anti-inflammatory medications such as corticosteroids, and often immune suppressives or biologics or disease-modifying drugs are added. Individuals with this type of severe lupus are usually on medication for many years. As far as the non-organ threatening, we generally start out with non-steroidals such as Advil or Aleve-like agents, or giving Plaquenil, which is an antimalarial, and sometimes we add low-dose or milder immune suppressants such as methotrexate. After many months, the non-steroidals can be usually tapered to just using it as needed. The immune suppressives may or may not be needed after a period of 6 to 12 months, let's say. But the Plaquenil or the antimalarials are usually given for at least about 5 years. So that really cannot be discontinued, although sometimes the dose can be tapered.
Does having lupus mean I can't or shouldn't have children? And will it make the pregnancy more difficult?
That's a very good question about lupus with pregnancy. First of all, there's certain antibodies that some lupus patients have that make pregnancy more difficult. Lupus fertility in people with lupus is usually normal, unless the lupus patient has been on immune suppressive drugs that have caused premature ovarian failure. And this is a very small percentage of lupus patients. There are certain antibodies that lupus patients have, such as anti-cardiolipin or anti-Rho or SSA antibodies, that warrant special consideration in pregnancy issues, such as cardiolipin can cause miscarriage and may warrant the use of low-dose aspirin or blood thinners during a pregnancy. The presence of anti-SSA can cause neonatal lupus or congenital heart block, and this can be screened for in those with an SSA antibody by doing a fetal ultrasound of the baby's heart or a fetal echocardiogram between weeks 18 and 24. And the only people we tell with lupus not to have children are those who have, let's say, are in kidney failure, have uncontrollable hypertension, or serious organ damage. And this is a very small percentage of lupus patients. But there are also, the rule is when lupus is very active, it's hard to get pregnant because inflammation prevents implantation. So it's always better to have the disease under good control before initiating attempts at procreation.
Well, if I should get pregnant, what medications, if any, can I safely take?
What the lupus patients who get pregnant can usually take antimalarials. They can also take corticosteroids. They can also take azathioprine, and they can take intermittent nonsteroidals. Other agents, and there's some evidence that belimumab or Benlysta is probably safe. We don't like lupus patients to take methotrexate, mycophenolate, or certain chemotherapy drugs such as cyclophosphamide. Sometimes cyclosporin or tacrolimus are used in lupus patients with kidney involvement who are pregnant instead of mycophenolate, for example.
Okay. Well, what about breastfeeding? Can I breastfeed?
Breastfeeding is safe with antimalarials and with corticosteroids, but any other drugs you should ask your gynecologist and pediatrician.